All right, today we are diving into one of the most common things you will see pretty much no matter what field you go into, the red eye. And look, it might seem simple, but this is a classic diagnostic puzzle, and getting it right is absolutely essential for protecting your patient's sight. And really, this is the question you have to ask yourself every single time a patient walks in. Is this just some benign irritation that'll go away on its own? Or is this an emergency that could cost someone their vision? Figuring that out and figuring it out fast is what this is all about. The challenge is, well, the list of potential causes is huge. I mean, it runs the gamut from something totally harmless like a broken blood vessel, all the way to these vision-threatening infections and serious inflammatory problems. That's exactly why you can't just wing it. You need a system. So here's our game plan. First, we're going to build your diagnostic toolkit. Then we'll zero in on those absolute can't-miss emergencies. After that, we'll talk about the more everyday stuff and then learn how to tell all of these things apart. And finally, we'll wrap it all up with the key takeaways. Okay, let's start with your toolkit. This is all about having a reliable, step-by-step method to assess every patient who comes in with a red eye. This is your foundation. So your assessment has to be methodical every single time. You start with a history. Is it one eye or both? Any recent trauma? And you have to ask about pain, any changes in their vision, and if they wear contact lenses. That last one is a massive clue. Then when you start your exam, the first thing you do is visual acuity. Always. Think of it like a vital sign for the eye. After that, check the pupils, take a close look at the pattern of the redness, and feel for any swollen lymph nodes right in front of the ear. This simple structure will help you cut down that huge list of possibilities right from the start. All right, now for the most important part, spotting the true emergencies. These are the red eyes where any delay in getting them to an ophthalmologist could literally cost a patient their vision. First on our don't miss list is hyperacute bacterial conjunctivitis. Just look at that thick, purulent discharge. We are not talking about a little morning crust here. This is often caused by Neisseria gonorrhea, and it comes on incredibly fast and can destroy vision just as quickly. This is an absolute emergency. Next up, keratitis. That's just a fancy word for inflammation of the cornea. The buzzwords here are major eye discomfort, blurry vision, and so often a history of wearing contact lenses. If you look closely, you might even see an opacity on the cornea, like that little white spot there. This is a true sight-threatening emergency. Then you have scleritis. Now, this isn't just redness. The pain is described as a deep, boring pain that's so bad it can wake you up from sleep. And notice that color? It's not just red, it's got this purplish or violaceous tint. That is a huge red flag. And what's really important to know is that more than half of these patients have some other systemic disease going on, like rheumatoid arthritis. Now let's look at uveitis, sometimes called iritis. The dead giveaway here is something called a ciliary flush. You see how the redness is packed right into a ring around the cornea, the colored part of the eye? That tells you the inflammation is inside the eye. Patients will also complain about pain and being incredibly sensitive to light. And just like scleritis, this is very often connected to systemic inflammatory conditions. And of course, if there's been any trauma, you have to look for a hyphema. That little pool of blood in the front of the eye is a sign of a serious injury. If you even suspect the globe might be ruptured, stop what you're doing, check their visual acuity if you can, place a hard shield over the eye, don't press on it, and call ophthalmology immediately. And whatever you do, do not try to check the pressure yourself. Okay, we've gone through the scariest stuff. Let's take a breath and switch gears to the things you're going to see way more often, the stuff that's thankfully a lot less urgent. And here it is, the #1 cause of red eye, viral conjunctivitis. This is your classic pink eye. It's usually in both eyes, has a watery discharge, and often the patient will tell you they also have a cold. The key thing to remember here is that the treatment is just supportive. Cold compresses, artificial tears. Antibiotics do absolutely nothing. Now this one looks terrifying, but it's totally harmless. A subconjunctival hemorrhage is basically just a bruise on the white part of the eye. It's completely painless, it has zero effect on vision, and it'll go away by itself in a week or two. Your main job here is just to reassure your very worried patient. And here we have episcleritis. It's an inflammation of that really thin, superficial layer covering the white part of the eye. It'll cause some redness, maybe some mild tenderness, but the key is there's no severe, deep pain and no change in vision. Think of it as the much less scary cousin of scleritis. All right, Let's put some of these diagnoses head to head, because this is where the art of medicine really comes in, being able to tell apart conditions that at first glance can look pretty similar. Okay, let's really nail down the difference between scleritis and episcleritis. It all comes down to the pain, the vision, and the color. With scleritis, you're talking severe, deep pain, possibly decreased vision, and that telltale purplish color. That's an immediate referral. Episcleritis, just some mild tenderness, normal vision, and basic redness. No referral needed. Getting this one right is so important.
Here's another classic comparison. How do you tell viral from bacterial conjunctivitis? Well, first, look at the discharge. Is it watery? That points to viral. Is it thick and goopy? That's more likely bacterial. Next, feel for those little lymph nodes in front of the ear. You'll often find them with a viral cause, but not bacterial. And finally, just ask. A sore throat or a runny nose strongly suggests it's all part of a virus. I want to circle back to this one sign because it is just so important. The ciliary flush. When you see that ring of redness that's all bunched up right around the edge of the cornea, you have to stop and think. This is not simple pink eye. That sign is yelling at you that there's a deeper, more serious problem inside the eye. It should immediately make you think of keratitis, scleritis, or uveitis, all of which are on our don't miss list. So let's boil all this down. If you walk away with just one thing, this next part is what you absolutely need to have locked in your brain for your next shift. Think of this as your red flag checklist. If your patient tells you they have severe pain, any change in their vision, or really bad light sensitivity, that's a red flag. If you look and you see that ciliary flush, a cloudy cornea, or that really nasty purulent discharge, that is a red flag. Any single one of these means you need to be picking up the phone and calling ophthalmology right away. And that brings us to our final, and honestly, our most important points. A person's vision is incredibly precious. So if you are ever on the fence, if the diagnosis isn't perfectly clear, or if something in your gut just tells you something's not right, what do you do? The answer, always, is to have a very low threshold to consult. Your job is to keep your patient safe, and sometimes the smartest and safest thing you can do is ask for help.